or a partial knee replacement, these exercises are for you. I consider these the two staple exercises you need to perform, okay? These top all other exercises, all right? You have to regain motion in your knee. That's the most important thing. Strength will come with time, but once you lose motion, it's very difficult to regain due to the scar tissue that forms. These exercises, I want you to start doing these exercises so you're very used to doing them prior to surgery. I want you to do them while you're in the hospital, and I want you to continue doing them when you're discharged from the hospital, and continue doing them for at least 3 months after surgery. This is how you're going to get the motion back in your knee. So first we're going to work on bending the knee, okay? So I'm going to pull up my pant leg to show you so I can demonstrate these exercises, okay? So the first thing you want to do is just bend the knee back as far as you can get it. Now you're sitting in a regular chair. It doesn't have to be any kind of a special chair. You do want an opening underneath, okay? Because eventually your knee will get back to the point where you're going to want to bend it further. When you get it to here, okay, I can't get it any further, this is what you do. You simply keep your heel down, pick your toes up off the ground. Okay, I'm going to show you again. Toes off the ground, heel stays put. Watch what my knee's doing. Do you see how my knee is bending ever so slightly? Do you see that? That's bent more than that. Now, I'm not bending my knee on purpose, but by using my heel and using my foot, I'm bending my knee. As you bend it, this is going to get easier. Your knee is going to loosen up. Okay? When it loosens up, we need to grab your other leg, pull it forward. The other thing you could do, okay, is to slide forward in your chair a little more, okay? But I think it's easier just to pull back with the other foot. Then you get to there, you're going to keep picking your toes up off the ground, okay? And you're going to keep doing that until it loosens up. And you want to do this exercise for at least 10 minutes. Just keep pushing back, preferably even 15 minutes, pushing the leg back, pushing the leg back, pushing the leg back. And you want to do that 3 to 5 times a day. I know it seems like a lot, but you're at home. You're not doing anything. Work on moving your knee. You went through all that surgery. You might as well get the best possible result, okay? So you're gonna push up, pull up, pull up. Now you're gonna get to a point when your knee's at about a right angle, like it is now, where really picking it up doesn't do a whole lot. Then I just want you to hold it there as long as you can. Let it stretch. Then you can slide back. And then here's the next thing you do. To bend the knee beyond this, all you got to do is slide forward in your chair, okay? This can be done anytime you're sitting, okay? And what you're using is your entire body weight. Now you'll notice this hip might come off the chair, but you're going to sit into that hip and drive that heel down, okay? If the knee starts feeling like, oh, this is too much, now you do the opposite. You pick your heel up off the ground. That'll bend your knee less. And then you can drop it down again, okay? Okay, so you can pump this leg some more in this position, okay? As you get some more loose, okay, it's important that you start in the back of your chair so that you can keep sliding forward. Now look how far I can get my knee bent without doing anything other than use gravity and passive motion. You're not lying on a bed, pulling on a rope, pulling on a towel that's on your knee. You're not using a sliding board to go back and forth 100 times. This is very passive. You get at that position, you hold it, and you push and you try to go farther and farther. Now this is also very important. Do not forget to breathe. You have to breathe. Nice and relaxed, controlled breathing, okay? If you're tense, you're never gonna get this leg loose, okay? Now here's the second exercise. You get another chair opposite you, because the second hardest thing outside of bending the knee is getting the leg completely flat. There's a tendency for patients to want to sleep with pillows underneath their knees because it's more comfortable. The problem with that is your knee for 8 hours during the night is healed in a stuck flex position. So when you wake up, it's here and you can't straighten it. So the next step is to get your leg up on a chair in front of you. You create space. And what I want you to do is contract these muscles and drive the knee towards the floor. So you're going to contract and go this way. You're going to contract and go that way. Now, the other thing that can be helpful, you can also put your hands on top. Don't put it on the incision because that'll be sore. But you can put it on the thighs, and you can, in addition to contracting the muscles, you can push down. The other thing that works is to also pull your foot back. Pulling your foot back and pushing down at the same time while contracting these muscles. And this does two things. It works on getting the leg straight, but it also works on contracting these muscles, okay? So those two exercises, bending the knee back while you're sitting in a chair. The other one, get your leg up on a chair, contract these muscles, drive the leg down. Drive the leg down by contracting these muscles and then using your hands to push down, okay? Now, those are the two most important exercises you can do. And again, you should be doing, I usually say if you're not trying to bend it, you ought to be trying to straighten it. Okay, try to do those two exercises throughout the day. All you need to do is have a chair. Most of us are in a chair most of the day, particularly after joint replacement. Do your exercises and you'll notice incredible results without going to the therapist. Okay, I'm not saying a therapy isn't important. I'm just saying that you can decrease your need for therapy by doing these exercises on a regular basis. Okay, and so I'm going to show you one more exercise. And this is, quite simply, to work on strengthening your quadriceps in a stairway or a stairwell. What you're going to want to do is have balance. You're going to have a railing to hold on to, and you're simply going to put your operative leg up and step up. And then step down, okay? You don't have to take this leg back off. You can leave it on and then just go up and step down. And then step up and step down. And now, that strengthening exercise should be performed about at least 15 repetitions for 3 sets. So you're going to do 15 repetitions 3 times. You'll take a break after each rep. And you try to do that at least 3 times a day. All right? Do these exercises.